Talk to us a bit about the fact that today, when we actually listen to people talking about the kind of diseases that are actually affecting people, the issue of HIV/AIDS, or the word HIV and AIDS, seems to be not being mentioned as much as cancer is being mentioned today. What does this signify? Is this a good thing? Is it a bad thing?
Well, first of all, thanks so much for having me. From North, we're having a very good conversation to keep talking about HIV.
Yeah.
But as you say, you can probably understand that in two ways. In a better way, that people actually don't see HIV as a disease for death, a death sentence as it was before, but rather than a disease that's manageable chronically. And on the other way, we should also be worried that if people drop their weapons, then HIV continues to spread. This is why we're having this campaign.
Yeah. And of course, every year there is actually a theme, and this year it's Know Your Status. And the sad reality is that according to UNAIDS, only 75% of people living with HIV and AIDS are aware of their status. That means there's a bigger number. 9.4 million people across the world are not aware of their status. How bad is this?
Well, you understand, if you don't know your problems, then HIV is a silent transmissions, then it can also destroy your immunity or defense. Then you have all types of opportunistic infections. So if, for the estimates you have, for Rwanda, the estimates are much higher, but again...
Of people who don't know their status.
Who don't know their status. We are now at 89%.
89%.
People know their status.
Of 89 of those who know, or 89 of those who do not?
Of those who are HIV know they have, they have been tested at least once. But those who don't know, what happens, they keep transmitting the virus, and they might die because the virus keeps destroying your body. And this is a big challenge, not only for those who have HIV, but also for the families and for the country. Yeah, it's a big challenge still.
Right. And so this, through this year's commemoration or marking of the International AIDS Day, you want people to actually go out and test and know their status, but we have this perception of people who tell you, you know, it's better not to know. What you don't know doesn't hurt you. This is usually what the perception people have. And the moment they know that they have it, they seem to die even faster, or, you know, spiritually, mentally, in many ways, they die faster than when they were living without knowing their status. How do you beat this perception to have people go and check and know their status now?
Well, that used to be the beliefs of many people when there was no solution. When you have the virus and you know you're HIV positive and no treatment, then you should be keeping the danger or the reality to come in your eyes for some time. But now we have better treatments. We have treatment that actually keep you live as you could be living if you don't have the same virus. This has been proven by evidence we have. So I would say some people still think that if you are HIV positive, it's the end of your plans and your lives. But now we are seeing a lot of good changes. People have HIV for the past 20, 30 years and are still enjoying their lives. They're still being active, producing, and also helping others to get up. So yes, it's still a problem we address. We're still educating people who still think that HIV 20 years ago is still the same HIV. I mean, the virus is the same. But the solution to the problems have been improving, and we're actually having more hope for the future.
Right. Of course, there's been new measures, as you just said, new ways of actually tackling this issue of testing, because some people would be scared of going to health centers to actually have their status known. And there's been an introduction of the self-testing kits, which has raised debate on whether it's a good thing or not a good thing, because if someone is within the confines of their room without a counselor there, without someone to comfort them, and then they find they're positive, it could lead to adverse effects. Let's talk about how Rwanda is managing this issue of the self-testing kits that are available now in the market.
Yeah, in the beginning we thought this is going to be a challenge, a problem, when people actually don't go for testing, when there's a professional helping you to understand and to know your status. But now we're talking about self-testing in a situation where you're alone, you don't have support, you don't have the doctor to help you. But things have changed. After 2 years of research on these self-testing kits, we've seen a lot of changes. And last year, Rwanda decided to move forward to implement this self-testing. And we are doing it in 3 ways. In public distributions, like you're doing for HIV testing. We are also doing it in public-private partnerships. So pharmacies will be selling these kits for whoever you want. You buy it. It's easy to use, and the minimum education and counseling is packaged with the kit.
Right.
So you can read it in Kinyarwanda, in French, and English, and you can screen yourself. It's not a final test. It's one step towards knowing your status.
Your status.
Yeah.
Rwanda has actually seen the numbers of HIV, new HIV infections, go down. By the time we were 2016, there was a drop of about 50% in numbers of new infections. Today, we are 2018. Talk to us a bit about the statistics. What sort of numbers are we looking at as far as new HIV infections are concerned?
Well, yeah, the statistics are improving. I mean, I've been working on this in this field for the past 12 years. Sometimes I see the drop and the trends. Yeah. So 5 years ago, the new HIV infections were dropping, but not the same way you're seeing it today. More than 50% of people who are infected annually are actually reduced. So today we're talking about 12,000 people annually infected. It's still a high number. But that was 25,000 annually. And we are seeing the same drop, the same trends, because of this treatment scale-up, because of self-testing, because of condoms. And this is actually not happening because people are changing behaviors, but because some biomedical interventions are working, because some solutions, like you take it because it helps you for this. Changing behavior sometimes takes years.
It takes time, but of course the efforts are paying off. Let's talk lastly about the minority groups, because in many economies we've also seen about people who are claiming that those who are from the minority groups, we have prostitutes and all those who are not, they cannot access this kind of treatment easily or support mechanisms. How is Rwanda handling this? Let's talk a bit about that really briefly.
Yeah, so we do have those groups we call key populations. You mentioned sex workers. For Rwanda, actually, is the group with the highest prevalence. Almost 1 out of 2 is infected with HIV. And they have clients who are men, like you, like me. Sometimes they have families and they get kids. So we have special programs for those groups. And what we do is to make sure they access prevention services, like condoms. Now we have condom kiosks in where they operate. And we provide them treatment in ways they access it. Like we open clinics in the evening because some sex workers are working in different time zones.
Right.
So those are adapted services that we are providing to those groups. Yes, and we're actually seeing some results.
Some results are coming in.